Thanks, Senator Burr. To all the witnesses, we have ongoing as a priority in this committee a project which we call innovation to try to identify how to move treatments, cures, devices from early stage development into the medicine cabinets, and to do that more rapidly and still do it safely. We're doing that in a bipartisan way. We're doing it parallel with an effort in the House called 21st Century Cures. President Obama is very interested in it because of his interest in precision medicine. I've talked with him about it. So what I'd like to say to the four of you and to your agencies is that train is moving through the station this year. We expect to finish that work this year. We already have a bipartisan working group of staff members that Senator Murray and I have constituted. So if there are specific legislative things that you need for us to do, now's the time to do it. We need specific recommendations. For example, Dr. Borio, if you need new tools to develop medical countermeasures that we've overlooked, or I wouldn't wait a year or two. I would suggest to us in the next few weeks what they are. And I think we will succeed with this. There's no reason we shouldn't because of the broad interest and support we have both from the administration and from the Democrats and Republicans on the committee. I have two questions I want to ask, but one, I want to go back, Dr. Lurie, I want to go back to this who's in charge question. When I was a governor, I used to have a phrase, who's on the flagpole? You know, if nobody was on the flagpole, nothing got done. If somebody was on the flagpole, usually we'd show up the next week and, you know, it got done because it would be that person. I think of Hyman Rickover, who would tell the captains of the nuclear subs, they'd have a 7-minute interview with him, and he'd tell them two things. One is you're in charge of the ship, you're in charge of the reactor. Anything happens to the reactor, your career's over. We never had a death. We never had a death as a result of a Navy reactor problem in the last 60 years in this country because of accountability. Now, we didn't have that with Ebola. Maybe it was our fault for not seeing it, but I expected someone to step up and say, and maybe this is the President's fault, somebody should have said, Dr. Lurie is in charge here. She's on the flagpole. If it had been a military operation, you would have had a daily briefing. I mean, we had a near panic in the United States over Ebola. I thought for a while that if I had announced or gotten someone to announce, or if you had announced that if you'd take your flu shot, you wouldn't get Ebola, we'd save 10,000 lives because people would go take a flu shot, an Ebola shot, because people were so afraid of Ebola. In Tennessee, public health departments were turned upside down because all they were doing was Ebola. In hospitals, they were spending all their time and money buying suits for Ebola. All that was good. The reaction was good, but it needed to be put in perspective, and people were afraid. So I think we should think about if the Assistant Secretary of HHS can't be seen in an epidemic as in charge, then maybe we should change the law. I mean, I know you thought about this, but first it was Dr. Frieden, next it was NIH. Then the President appointed a czar who became the phantom of the White House and disappeared and was never seen again. Now, maybe he did a good job, but none of us would know it. He wasn't available to testify before this committee or any other committee because he was a White House czar. So this is something we should think about before we have another incident like that. Now, let me go to you, Dr. Robinson. I was at Dr. Crow's, I think James Crow's work at Vanderbilt University. He's developing antibodies for Ebola, one of the most advanced centers for that kind of work down there. It was very, very impressive he did some of the work with ZMapp that has been mentioned, but he talked about the valley of death. And his antibodies for Ebola are many years away from being available to help cure someone. What else can we do about the so-called valley of death, which is generally described as somewhere between phase 1 and phase 2? How can we compress that, both for identified threats and emerging threats, like Dr. Crow was working on something called
chikungunya.
Yeah. Now that's not an identified threat. That's another one of these things that here it comes at us from out of left field, and it's not even in line with an identified threat. What else can we do about the valley of death? And I'd conclude by by saying again, if there are legislative things we need to do, this year is the time to do it.
So thank you for the question. There are two things I would say. First is that BARDA has been able to make mature programs for CBRN and pandemic influenza. The third part of what Papa put us in charge of doing was making medical countermeasures for emergent infectious diseases. We haven't, until the Ebola epidemic, actually been able to really get into that space. And we now are fully there with all our response capabilities and everything that we've done for the others. We are setting up an emergent infectious disease division that will have response and preparedness responsibilities, and we need to be able to afford to do that and prioritize those high threats for emerging infectious diseases to do that. The second thing is our Centers for Innovation and Advanced Development and Manufacturing were for advanced development. But what we had to do, because candidates were so early in development, we had to reach back very early. And we realized that's something that we do well and we can go forward with, and actually being able to take with response capabilities early development, even almost discovery, and bring them forward. We did this with Ebola monoclonal antibodies with several companies starting from scratch, and they were able to do it in 4 or 5 months, and now we're being able to go into non-human primate studies, and we'll be going into clinical studies later. We can do that, but we need to be able to have the resources to do so.
Senator Warren.